Here we're going to cover drugs and supplements to enhance performance. So we're going to be looking at some common performance enhancing drugs. We'll talk briefly about some rules and regulations around drugs as it relates to sport competition. We will be spending a little bit extra time. We have a whole chapter dedicated to drug testing, but we'll mention it briefly here and just talk about some nutritional supplements because it's obviously not going to be uncommon for physically active individuals to be supplementing. We'll kind of talk about a few common supplements, the good, the bad, what ones work, which ones don't, and kind of cover that as those questions will definitely come up with patients that you'll be treating. So in looking at nutritional supplements, so just again, be aware when we're talking about dietary supplements, so, again, when you're looking at supplements, they are not approved. The FDA does not approve of dietary supplements, okay? So to help ensure that supplements are safe and effective for their intended use, products intended to be used to treat a health condition must gain FDA approval. But if they're not utilized to treat a health condition, they don't need specific approval for the FDA. Okay, so, and here we're going to be, you guys going to talk about, we're going to be looking at some different supplements as they relate to nutrition and performance. So again, we're going to talk about some of the various classes of supplements that we're going to discuss. If you look at the table at the start of the chapter, it goes through some different drug classes. Now it has, for instance, like it does have creatine as a performance enhancing drug. Creatine is not a drug. It does enhance. There are performance benefits to creatine, but the rest of that table, you look at that, you could kind of see some different performance enhancing drugs and supplements. Again, we're going to be looking at those later on to kind of determine what works and if there's any potential drawbacks to any of the supplements. So again, it's important for athletic trainers because again, they're kind of the one of the resources for athletes. They need to have an understanding of banned and illegal performance enhancing drugs, and you need to be aware of if your athletes are taking any types of drugs that could possibly give them a positive drug test. So that is something to be aware of. So again, obviously always having a list of those particular drugs that they're on to make sure nothing's going to cause them to have a positive drug test. So looking at banned substances, and again, we're going to be talking about drug testing in a later chapter, but just to kind of make some note of it here. So again, not all legal substances are cleared for competition. So it's very important to be aware of any prescription medications because again, just because something has been legally prescribed, it could still be banned or prohibited in competition. So it's really important to be aware of that, having all your medical documentation and have that all kind of in place ahead of time just to avoid issues. The World Anti-Doping Agency is going to be the group that's responsible, and they're the primary agency that's developed the list of banned substances that could give athletes a competitive edge or possibly enhance their performance. So they consistently look at this list and see if it needs to be updated. Again, just with the idea of, creating, if you will, a fair playing field. In the United States, their agency is the United States Anti-Doping Agency, so that's the domestic governing body in the United States. So most competitive sports in the United States subscribe to all or part of the World Anti-Doping Agency and use, so that's pretty much used as the model. However, in the United States in particular, the USADA is responsible for looking at that. So there's no published list of approved drugs or supplements. So, you kind of have to be aware of what is banned. So, and the banned substances can vary slightly. So there's the substances that there is basically a full ban. So these are substances that are basically prohibited at all times. These are things like your anabolic agents, peptide hormones, growth factors, beta-2 agonists, hormone and metabolic modulators, diuretics, and masking agents. So those are the substances that there's pretty much a full ban on. There are substances that are on ban basically during competition. Those are things like your stimulants, narcotics, cannabinoids, corticosteroids. They're basically banned only during competition. And then there's some that are actually banned in specific sports. So you have specific sports where there's particular things that are banned. Alcohol is banned in certain sports, and beta blockers can also be banned in certain sports as well. So that's where you'd have to look. So again, anytime you're looking at a prohibited drugs list, it may kind of point that out, where there are some drugs that, depending on the sport, may even be banned. So when we're looking at supplements for enhancing musculoskeletal performance, and we're looking at performance enhancing drugs, obviously one of the most prevalent that we look at are your anabolic androgenic steroids. Again, there's various types and classifications of anabolic androgenic steroids. We'll kind of talk about some of them. Basically, an anabolic steroid is any drug or hormone substance that's basically chemically related to testosterone. So that's what we're basically looking at there with anabolic steroids. So the DEA has actually established guidelines for anabolic androgenic steroids, and they are listed as a Schedule III drug, with the acknowledgement that they carry a moderate to low risk of both physical and psychological dependence. And we'll kind of talk about some of the potential side effects of steroids, and how that kind of, becomes an issue for some of the safety as regarding their use. So in 2006, 45% of all positive drug tests were steroids. So they're still very prevalent. The textbook does get into some of the background and story as to how steroids became popularized. I mean, it goes back as far as the 1950s in international weightlifting competitions. But since then, as time has gone on, we've seen potential negative effects from taking them beyond what they're able to do in athletic competition. Be aware of the NATA position statement. So, obviously, as good practitioners in athletic training, sports medicine, NATA position statements are kind of our guiding area to practice on. And, typically what you will see as far as the use of anabolic steroids, again, there is the potential for adverse effects. However, we obviously know that for the most part, it's basically people who are using them typically for cosmetic purposes, to grow muscle mass. And again, they do have people that advocate for their use in these circumstances. There is currently, right now, as your book discusses, there were some medical applications to various types of anabolic steroids. However, it's not 100% that they work. So for instance, initially they thought it would be beneficial for women with osteoporosis. As we had talked about, bisphosphonates have kind of becomes your primary medication used for that. So that's sort of supplanted that. People thought in people with HIV and renal failure, or even burn victims, could be treated with this, and there's just not as much good evidence. So again, even in times with medical conditions, the results they have been published, they're kind of moderate at best. We do know that from an ergogenic perspective, the things we talk about and we'll discuss later on with muscle mass, they are very effective. Your general categories. So as we said, an anabolic steroid is basically any drug or hormone substance that can be chemically related to testosterone. So, again, there could be derivatives of testosterone and things in that nature, but that's basically what they act like in the body. So you have just, straight testosterone, androstenediol, norandrostenedione, are different types of anabolic steroids. There are plenty of others that are available as well. Again, they all have similar ergogenic benefits that we will talk about, however, with some adverse effects that, again, kind of are major drawbacks to their use. So in looking at this, the ergogenic rationale, or basically the reason why individuals will take anabolic steroids, is to basically increase lean muscle mass, which it is they are very effective at. Okay, so basically what they do, and it's a little more complex than this, but for our purposes right now, just understand that they basically allow a greater amount of protein synthesis in post-workout recovery. So what they essentially do is they allow you to, without getting into the deep science of it, just understand they allow you to work out, for a longer period of time, harder, and it allows you to recover. So basically, if like you had someone that was taking steroids and they were doing a super high volume of heavy strength work, if a person tried to match that, they wouldn't get the same results because they wouldn't have the same recovery properties. Individuals that take steroids, it basically allows for a greater amount of protein synthesis, which allows for that increase in lean muscle mass. However, what ends up happening is many times, and where a lot of the issues come in, is that people start to increase their dosages. So, and that's the one thing you'll find with, and this becomes a big problem, athletes will typically take very high dosages of anabolic steroids in an effort to continue getting benefits. So again, that's the primary benefit. Again, the biggest thing is that allowing in recovery. However, when we start to look at like, what is adversely affected by anabolic androgenic steroids, so basically a lot of different systems and organs could be affected. So again, there could be general cardiac dysfunction in individuals that take anabolic steroids. Hematologic, one of the things is their blood work, particularly their cholesterol. It does change their HDL, LDL values to mimic some risks with that. There's liver dysfunction. Individuals could start to experience jaundice. There's neuroendocrine issues. So this is probably one of the biggest things, and some individuals are willing to obviously take these risks, but when you look at what happens with men, testicular atrophy, gynecomastia, or basically growing breast, libido change, prostate hypertrophy. In women, you have virilization, clitoral hypertrophy, and menstrual dysfunction. So there is definitely issues that both men and women will experience differently with this. Also in the renal system, there's the risk for kidney stones or cancer, and focal segmental glomerulosclerosis are issues that could happen in the kidney. So as you can see, while again they are very effective, we do know that an individual taking steroids will increase their strength, lean muscle mass. However, the drawbacks and the significant health risks are a major issue that kind of that someone would be possibly faced with. Now we also look at another aspect of this is the mental health aspect. So, there does tend to be, and there's still some debate around this, but we do tend to find that there is the potential for regression secondary to anabolic androgenic steroid use. Okay, so, and what we look at is up to 60% have reported some form of aggression or irritability, or what people have kind of tagged roid rage. And other people have also made mention of like mood swings, psychosis, addiction, and depression. Part of the issue that a lot of people end up, or one of the major red flags for concerns, is the body image thing. So people start taking steroids and they kind of develop some body image issues that possibly will further contribute to greater use. So that's one thing that you do need to be aware of. You do tend to find that you get people with, people get what's called muscle dysmorphia. So even in somebody who has if say they're without taking steroids, they work out and they have a muscular build, but they just keep constantly looking at themselves as that they're weak. It's basically something similar to like an eating disorder where someone thinks they're overweight and they're not, or they have a weight problem and they certainly don't. It's kind of the same thing. That muscle dysmorphia can certainly play a role with that. And then the dependence, so it does meet the standard for a substance abuse disorder. So the DSM, or the Diagnostic and Statistical Manual for Mental Disorders, it does reach the standard for that. So 30% of anabolic androgenic steroid users do kind of meet that criteria. And a lot of times what at least they've found is that people tend to fit a certain profile, if you will, to kind of fit this sort of like, the psychological issues behind this. So, they look at, childhood conduct. They tend to be less educated and possibly even abuse other drugs. So there's other, you know, sort of sort of the background or life experience of some individuals can kind of drive them, much like with a lot of, mental health disorders, can kind of drive them to wanting to use steroids and possibly become dependent on them. So another performance enhancing drug, human growth hormone. So we've talked about human growth hormone in the pathology section of the class. So again, be aware of what human growth hormone does, but effectively it is a peptide hormone that gets secreted by the pituitary gland. If we just look at kind of like normal physiology behind human growth hormone, it does kind of fluctuate throughout the day. So it is affected by factors like sleep, stress, exercise, can all kind of affect the circulating levels of human growth hormone. It plays a very critical role in human physiology because it affects basically various systems throughout the body. So again, some of the things it just basically does is it stimulates skeletal and organ growth, it regulates lean body mass, it assists in regulating the immune system. So it does play a very critical role in human physiology. It affects various systems throughout the body. Typically, it can be prescribed, so it does have a prescription purpose. In particular, things like, in individuals that have HIV and AIDS, that experience like tissue wasting due to that, it has had some good use for that. Also for individuals who have like some growth and development issues, so particularly for people who are, extremely short stature, again, they have some sort of like developmental disorder, it is prescribed for those reasons. The significant risk you have with utilizing human growth hormone is the development of acromegaly. So acromegaly, as we all know, is when a person starts to get abnormally large features in their body, and there's some other health issues associated with that. Again, that was something that we had touched on in the pathology section of the class. Benefit as a performance enhancing drug. So very, very similar to when we look at the what we saw with anabolic steroids. It does have it's people in like particularly sports, but more so even in like bodybuilding. It is the potential to increase muscle mass that you can get. So again, an increase in muscle mass that can result from it is really what individuals look for, or even like a decrease in lean mass that you could get from human growth hormone use. So numerous baseball players have used this to enhance performance. That was discussed in the book. Many times it's popular for women who basically want to get similar effects to anabolic androgenic steroids, but they don't want the side effects. So if women want to increase their muscle mass, increase physical performance, what they'll sometimes do is they'll use human growth hormone instead of steroids because they want to avoid the virilization and some of the other things that happen with anabolic steroids. However, again, there's issues that could come about as a result of this. Many anti-aging clinics use human growth hormone. Again, it is something that it's not recognized by the FDA as a viable treatment for any type of injury care, and it is banned by all sports governing bodies. So it is something to be mindful of. So, off-label use is prohibited by the FDA. You cannot use this for things other than the prescription purposes that we talked about. So again, athletic performance is not accepted by the FDA. And physicians cannot prescribe PEDs. They can get themselves in trouble. Now, one of the other things with human growth hormone that we do want to mention, the half-life of it is about 4 hours for a subcutaneous injection, and it's 22 minutes for IV administration. So it's basically it's very difficult to detect. So that is one thing that is challenging from the standpoint of drug tests is human growth hormone is very difficult to detect. The other thing is the kind of the pulsatile nature of the physiologic delivery throughout the body. You have various concentrations of the hormone throughout the day, okay? It's also much less concentrated in the urine than in the blood. So basically, really to get an accurate test, you basically need to do blood testing within 24 hours in order to best detect it. So like a urine test, for instance, you're gonna have a much more difficult time to detect. Probably another reason that makes it a popular option for some people if they did want to take human growth hormone as a performance enhancing drug. Again, it is banned, and physicians who do prescribe it, if it's not prescribed for one of the medical reasons that's accepted, there's only 5 accepted clinical diagnoses that where it's a therapeutic use for. Other than that, we had mentioned just 2 as an example. But in general, it's not. A physician could basically lose their license if they prescribe it without it being for that purpose. So creatine monohydrate, now they're putting it under the performance enhancing drugs. It's not really a drug. I'm not quite sure why your textbook does that. It is a supplement though. Is a supplement that became popular to assist with increasing muscle mass. It became really popular in the 90s. And what creatine is, so again, creatine monohydrate, which is the most effective form of creatine to use, it's an endogenous substance that's synthesized naturally in the liver, kidneys, and pancreas. So you do actually find this naturally. So, if you eat a lot of meat and fish products, you do get a lot of creatine in your diet. However, there have been benefits to supplementing, and the idea is that part of what the idea behind using creatine is that it has a role in the resynthesis of adenosine triphosphate during exercise. So if you remember the ATP PC system and how the body uses phosphocreatine in the body, there's the belief that you can get benefit from that by supplemental creatine, and it has been found to be very effective as far as use. So this is a pretty interesting supplement that's actually gained popularity more so even for some non-athletic uses. So what we're actually finding is that there's some non-athletic use in medical purposes. For instance, they found in individuals with Parkinson's disease that there's an improved chair rise test. They find with spinal cord injury, you get increased upper extremity work capacity, and they found in concussions, which is really interesting. So in sport-related concussions, individuals supplemented with creatine can actually can have more resiliency to that traumatic brain injury. So basically, if somebody who has suffered a concussion, they can actually get benefit from taking creatine. However, as your textbook pointed out, there's no conclusive evidence that nutritional supplements have a neuroprotection role in humans, but it is something to think about. So they are starting to see that it does help in recovery from concussion. So this is a fairly, and again, it's a safe supplement. A lot of the early concerns about some side effects have kind of been dispelled for the most part. But creatine, again, a good option for somebody who is looking for a supplement that is very effective, particularly in regards to activities, show again more short duration, strength, power-based activities. So looking at so these would be some popular supplements for individuals with skeletal conditions. Very popular one, particularly for individuals with joint pain or people that have osteoarthritis, is glucosamine chondroitin. So glucosamine and chondroitin sulfate are basically endogenous chondroprotectors. In other words, they're sort of like natural components of your cartilage and synovial fluid. So the thought process is that they can actually assist in individuals that potentially have osteoarthritis. So now something to note that there's, as far as like what we've seen in research, there's inconsistent benefits, but it still does seem possible that it could possibly help in individuals with osteoarthritis. So there's appreciable research that supports potential use. We don't have definitive use, but it does seem possible, and in theory, it would make sense to, if you can supplement with this, given it's a natural component of the cartilage and synovial fluid in the tissues, that it could have benefits, particularly in individuals that have osteoarthritis. When we look at the chondroitin sulfate in general, and again, many times these two substances are usually combined in the supplement, but just looking at chondroitin sulfate, so they find that individuals who that chondroitin sulfate can inhibit cartilage degradation and stimulate processes, can be anabolic for new cartilage. Now, as far as the efficacy of that, what we look at is, as far as the dosage for that, about 1,200 milligrams a day, individuals will get secondary pain relief. There's been a 2-year study that actually showed that, a 2-year study that showed combining both chondroitin sulfate and glucosamine resulted in a reduction of joint space narrowing compared to a placebo. So there does seem to be the idea that this can be a viable alternative to NSAIDs. So the other thing to keep in mind, so we find this with chondroitin sulfate combined with glucosamine. Glucosamine itself does inhibit the inflammatory process, which then could also and can increase the concentration of what's called hyaluronic acid, which is a part of your the concentration in your synovial fluid. So that's something to be mindful of. Another kind of study, they showed that 1,500 milligrams per day of glucosamine supplementation actually did help improve mobility and have less pain. So there is some benefit to this. Again, the research kind of bounces back and forth, but there should be some. It should be considered a viable option potentially to NSAID. So, again, decisions based on the supplementation, you should look at how far has the pathology gone? Is there any existing comorbidities? All of that, again, in conjunction with the physician should be looked at, as far as, the pluses and minuses of, taking this maybe in lieu of an actual NSAID or something of that nature. So you could look at it as somebody who maybe even just has like a mild osteoarthritis, as this possibly being something that they can take instead of doing the non-steroidal anti-inflammatory drug. Some other supplements we look at here: omega-3 fatty acids and vitamin D. So omega-3s are a very popular thing that can play a role in various issues. We're going to reference it here looking at joint health. Some people will take omega-3 fatty acids to kind of assist with, like, heart and cholesterol issues, but we'll look at it here from the standpoint of joint health. So we do know that omega-3 fatty acids do play a role in joint health. Actually, when we look at this, we look at the idea behind it is that you get greater collagen synthesis and fewer inflammatory mediators. A study did show that combining, going back to the previous supplement that we looked at, glucosamine, that individuals that supplement with glucosamine, omega-3s, particularly those that have your DHAs included as well, reduced pain in patients with hip and knee osteoarthritis. So we do see that there are some benefits to, particularly in when you combine these various supplements. Adding vitamin D to that actually contributes even further. So looking at vitamin D, and again, there's vitamin D receptors in basically every tissue in the body, and this is another supplement that has gained a lot of popularity, particularly over the last few years. And again, there's receptors in basically every tissue in the body. So we know that, like, vitamin D itself could influence, again, some various tissues. It's included in bone, muscle, immune cells, very important in immune health as well. in kind of looking at vitamin D supplementation. So if an individual does have low levels of vitamin D in their blood, we do know that bone resorption will occur in order to meet calcium demand, and that puts somebody at risk, a greater risk for stress fractures. So below the 32 nanograms per milliliter, parathyroid hormone levels are going to have to increase, which then is going to cause bone to basically get broken down so that the calcium can go into the bloodstream. So that's essentially what you look at physiologically what's going to go on. Sunshine is actually your most plentiful source. Now there are parts to the world, well, even here in the Northeast, as you know, it gets darker out earlier, people aren't as exposed to sunlight. So in the Northeast, it is not uncommon to have individuals with low vitamin D levels. And again, probably the biggest thing we look at is the deleterious effects to bone health. So, you know, vitamin D supplementation is a very standard component of bone health. If you have athletes, and again, this is common to see in female athletes that have, you know, issues with stress fractures, they should strongly consider a vitamin D supplement. Okay, so when we look at the different vitamin D data, so again, there's different forms of vitamin D that we're going to talk about. So there's 25 hydroxy vitamin D, or we would think of just, you know, just regular vitamin D. Basically, that's the active form of vitamin D that gets measured in the blood. You have vitamin D2, which is available as prescription only. So you can only get vitamin D2 by prescription, and it's available in the particular units that are there. The other name for that is ergocalciferol. Vitamin D3, this is probably the more potent, longer acting vitamin D. It's actually more potent and longer acting than vitamin D2. And you could get vitamin D3 over the counter. It's available. It's frequently used in daily dosage between 1 and 5,000. You can possibly end up, you know, going up to 35,000 international units. So vitamin D3 is probably the one that you're going to see very much more commonly utilized. That's known as cholecalciferol, is the other name for vitamin D3. Again, the key marker being for individuals is if somebody has vitamin D levels above 32 nanograms per milliliter, that's considered sufficient. They're considered deficient if it's less than 20, and insufficient if it's between 20 and 23. So we really want to make sure that those levels stay at a certain point. So, and again, your vitamin D supplementation, you could go up to 5,000 international units a day. And again, that vitamin D3 tends to be your most potent source. So looking at blood doping, so again, doping is just the use of banned substances and performance enhancing drugs in athletic competition. So they use the term doping as kind of like a general term utilized. So whereas when we talk about blood doping is the actual practice of using techniques to enhance red blood cell volume. So what you're effectively looking to do there is increase the concentration of your red blood cells, also known as your erythrocytes, to carry more oxygen to the muscles, because the idea is if you have more red blood cells, you get more oxygen to the muscles, and that kind of helps, particularly with aerobic capacity and endurance. So this is a practice that you'll see if it does get used by more endurance type athletes. There's kind of 3 ways that individuals will do blood doping. One is using erythropoietin, and then the other 2 are just using either a synthetic oxygen carrier or through blood transfusions. So erythropoietin, as we had talked about in pathology, that's a peptide hormone in the kidney that increases red blood cell volume. So individuals will use EPO, that will increase their red blood cell activity. And you go, versions of EPO are actually used to treat things like anemia, kidney insufficiency, in individuals that have chemotherapy or if they have HIV-related issues. So it is a peptide hormone that is used for medical purposes. However, as we said, athletes will use this in order to kind of gain an edge in competition, if you will. The other things that will get done is that individuals, as I said, will use a synthetic oxygen, some other form of a synthetic oxygen carrier, or what they'll do is do a blood transfusion. So, they'll have their blood taken out and then put back in as a way to kind of artificially increase their red blood cell count. So again, basically that's what you're looking to do in blood doping. You're effectively looking to increase blood cell volume, which will therefore increase your ability to carry oxygen to the muscles. So if you are going to utilize the peptide hormone, so one of the medications that's used is what's called Epigen. That's administered subcutaneously, and there's an intravenous option as well. Again, for individuals that have kidney disease or on chemotherapy and have issues associated with that, again, anemia, what have you, it's a perfectly good use. The risks of blood doping in particular are obviously all related to the cardiovascular system. So there's a much greater increased stress on the heart with this. There's the risk for blood clotting and stroke in individuals that do this. It was the World Anti-Doping Agency put a ban on it in the 1990s, and it was first introduced to test for it in the 2000 Olympics. So again, the big issue here are the cardiovascular risks, which would make sense if all of a sudden now your body's producing a high level of red blood cells. If you have a normal red blood cell count, it does put you at risk for those cardiovascular complications. Okay, beta blockers. So we talked about beta blockers earlier in the semester. They are a drug used to control hypertension and cardiac arrhythmia. They're also used in individuals that have angina and have anxiety. So interestingly enough, those are banned for shooting sports. So if you think about it, individuals who are in a shooting sport, kind of having a steady, kind of relaxed hand is very important. So these are actually banned in these particular sports. So it should be mindful that athletes will use this in order to kind of slow their heart rate down and kind of lower their blood pressure. Okay. So now, as a side effect, it could possibly cause blood pressure to drop too low. It could possibly cause spasm in the airways. It could cause sleep disorders. So those are all things that could occur if people are just, kind of haphazardly using beta blockers as a performance enhancing drug. Again, where you typically see these is in shooting competitions, because again, it kind of causes them to relax, and it is not approved for anxiety. So it is not a drug that will typically be a first line use for anxiety. It can help with it. More so from the cardiac aspect of it, but it's not. It actually is not directly approved for treating anxiety. So it's important to kind of look at that. Again, be aware of this in these particular individuals, as this is where these particular drugs will be used. Deer antler velvet is a supplement that was sold a couple years ago. It became very popular, and it was marketed with the claims of improved athletic performance, particularly regarding strength and testosterone levels. They did think that it had the ability to improve testosterone levels, and basically it looked at that deer antlers that were a source of insulin-like growth factors, particularly in the antler tips, and that there were other sort of minerals. They found there's free fatty acids in the antlers. So the idea is this deer antler velvet could possibly improve some of these measures. Interestingly enough, there's no real evidence of gains in when you look at testosterone, oxygen consumption, or even in erythropoietin. There's no evidence to suggest that deer velvet powder can can enhance testosterone or erythropoietic properties. So it doesn't really have any added benefit. They've done studies on it. So this was something that was kind of put there out in market, but is not really shown to provide any evidence in athletic performance. So looking last at stimulants. So, stimulants are very popular for individuals, particularly as it relates to energy, but there's also the idea of possibly helping improve body composition. So many of the nutritional supplements that we look at as far as a stimulant contain what we call the Asian herb mohang, okay, also known as ephedra. So the stimulants that we look at are ephedra, ephedrine, pseudoephedrine are some of the various names. Again, here we're looking at all basically what we call sympathomimetic alkaloids. That you actually will commonly see when you look at like ephedrine and pseudoephedrine. These are things that we find in like nasal decongestants that are available over the counter. Again, they all kind of stem from the Asian herb mohang. Again, there's various medical remedies in Asia that this gets used for. Ephedra itself was one of the many nutritional supplements that was actually initiated as a weight loss drug. It was marketed as a weight loss drug. Eventually, the FDA had a warning on it and did eventually ban sales due to the risk of heart attack and stroke that they were seeing with ephedra. Multiple high-profile deaths occurred with it, so the FDA did ban it. Pseudoephedrine, which has been used to manufacture the illicit crystal methamphetamine. So now, for instance, when you go to buy an over-the-counter decongestant at the drugstore, you're required to show they have to scan your ID. And the reason for that is people learn that they can manufacture crystal meth. So people were going to stores and buying large amounts of pseudoephedrine and making crystal meth out of it. So now you're actually limited with how much crystal meth that you can actually purchase. Again, this was actually very popular. They actually found this to be very popular with professional ice hockey players as a decongestant, but also as an ergogenic aid. As an ergogenic aid, it doesn't really have great benefits. If you are looking to use a stimulant that as an ergogenic aid, you're actually better off just using caffeine. Caffeine is a much better, much more effective ergogenic aid. So I would say, to your athletes, use the pseudoephedrine if you need a decongestant, but don't use it in an effort to improve your performance. If you want to improve your performance, consider experimenting with caffeine because it's basically a much better form. So again, some of the concerns you do have to be aware of with any stimulant, again, is obviously the cardiovascular effects associated with that, the increased heart rate, increased blood pressure. Again, that's why ephedra was banned, because it was linked to heart attacks and strokes, sudden death in otherwise, pretty healthy individuals. So that's why ephedra itself was removed from the market. Again, pseudoephedrine is still available. Again, you're limited in your purchase with it. Very good for helping with as a decongestant. If you want an ergogenic aid, again, caffeine, and you'll probably have fewer potential negative side effects from the caffeine and get benefits from that. So you could, discuss with your athletes the potential in using caffeine and how that should be utilized. Before getting into the summary, the chapter did do a little brief talk on cannabinoids. We're going to do a whole chapter on that. So we'll talk about cannabinoids and cannabidiol and THC and kind of talk about how that's getting utilized nowadays, but we'll wait for that in that discussion. Again, supplements, it's important to be aware of supplements, and again, new supplements come out as a part of continuing education. There'll certainly be others that we did not talk about, to be aware of those. So again, you want to make sure that any supplement is used appropriately, that you be aware of evidence to educate your athletes, clients, patients on what to do. Again, medications, you do have to be aware of medications with a medical performance and athletic performance, meaning that, particularly if an individual is trying to use a medication off label, they need to, be aware of the dangers associated with that and the issues associated. Even something that may seem as like kind of benign, like using, I brought up using the pseudoephedrine as as a performance enhancer. There's a situation where they're better off using something like, if they really want to use a stimulant, utilize caffeine. They probably will have fewer side effects from it. They could experiment with low doses and try that. Caffeine has been vetted as a performance enhancing, not a performance enhancing. Well, I guess it is. Caffeine is a drug. There are benefits to it. So again, just making athletes aware of that. And again, be aware of supplements that are not based on science. For instance, like the deer antler velvet, some of the purported benefits of it, as we found out, don't actually occur. So again, in any other supplement, the supplements do cost a lot of money. Be able to educate your athletes, have your resources available that you can utilize when educating individuals on these. And these are your objectives.